After I returned from the public health meeting yesterday with community leaders and school officials in Comal County, Heather suggested I send an update to everyone because what we are hearing privately from the CDC and health department is so different from what you're hearing in the media. Some of you know, so some of you, or maybe all of you, but I will just list the facts that I know. The virus is infectious for about 2 days prior to symptoms onset. The virus sheds more than 7 days after symptom onset, possibly as long as 9 days. That's a total of 11 days. Since it is such a novel new virus, there is no herd immunity, so the attack rate is very high. This is the percentage of people come down with a virus if exposed. Almost everyone who is exposed to the virus will become infected, though not all will be symptomatic. This is much higher than seasonal flu, which averages 10 to 15%. The clinical attack rate may be around, this is a quote from the feds, he says, may be around 40 to 50%. That is the number of people who show symptoms. This is a huge number. It is hard to convey the seriousness of this. The virulence or deadliness of the virus is as bad here as in Mexico. Now that's the question we've always been needing the answer. Is it race specific? Is it chemical specific because of the toxic waste and the people being run down in Mexico, the poor? One of the biggest and poorest cities in the world. Reportedly the biggest and poorest. Okay, now, and I'm getting this from other doctors and other people, okay? You understand this is being confirmed right now. The virulence, deadliness of the virus is bad. Is as bad as here in Mexico. The virulence and deadliness of the virus is as bad here as in Mexico, and there are folks on ventilators here in the U.S. right now. This has not been in the media, but a 23-month-old, see, this was Tuesday night, and then he died the next morning. So this went out Tuesday night. I got this yesterday. See, this is confirmed, time-stamped. He knew about this from the feds before. He's in New Braunfels, south of Austin. He knows about the baby beforehand. But a 23-month-old near here is fighting for his life, and a pregnant woman just south of San Antonio is fighting for her life. In Mexico, these folks might have died already, but here in the U.S., folks are getting Tamiflu and Resolene quickly and have ready access to ventilators. We just got a secret Pentagon document confirmed that says the Tamiflu, the military is admitting, doesn't help the troops, by the way. What this means is that within a couple of weeks, regional hospitals will likely become overwhelmed. Did you hear that? Some of the kids with positive cases in Comal County had more than 70 contacts before diagnosis. That means they're saying 35 of them will get it. There are 10 to 25 times more actual cases, not possible cases, actual. Did you hear that? Than what is being reported in the media. This is 2 days ago. The way they fudge on reporting this is that it takes 3 days to get the confirmatory nod from the CDC to give viral culture. But based on epidemiological grounds, we know that there are more than 10 cases for each confirmed case right now. Now here's the key. During the night, we crossed the threshold. This is 30 plus hours ago. I don't know how many hours ago is 10 o'clock Tuesday night. How many hours is that? More than 36. During the night, we crossed the threshold for the definition of the World Health Organization Phase 6 global pandemic. This has not happened in any of our lifetimes so far. We are in uncharted territory. They've now announced it's a global pandemic, by the way. I expect President Obama will declare emergency sometime in the next 72 to 96 hours. This may not happen, but if it does, I will be surprised if it doesn't. When this happens, all public gatherings will be canceled for 10 days. I suggest all of us avoid public gatherings. Outdoor activities are not as likely to lead to infection. It is contained areas and close contact that are the biggest risk. And it goes on. I got to go to Tim Penny because I'm coming up on TV in a minute, and I apologize to her for talking the last 8-9 minutes, but I had to put this out. Then Biden. We have this last night, and we're so conditioned around here that, for incredible news, we don't even really do a story on. There's no sleeping anymore for my crew. This is what everything we've been working towards to fight. It's now coming to a head everywhere. The whole world's listening to us, literally tens of millions right now. We are exploding right now. We are fighting the enemy. We are engaging the enemy. We are in the X-Wings, in the trenches, on the Death Star's butt right now. We are on their tail. And this is life and death. We have got to get the maximum effort, and everybody has got to mirror all the stories at Infowars.com and PrisonPilot.com because we are under unbelievable attacks confirmed right now to shut